Warm hello and welcome. I'm Coach Ray, your go-to for narration and conversations on topics that keep you alive and well-ish. Follow me for practical tips, expert insight, and motivational stories to help you build a better life. Thank you for joining me today. I'm going to be reading the article that I wrote titled, Why Preventative Health Screenings Matter and Where to Get Them. How many of us are guilty of seeing a doctor only when something feels off? Or maybe really off? No judgment here, I do it too. But what if we started thinking about our health while we're still feeling well? And then we caught those potential problems before they even start. Today, we're going to dive into why preventative health screenings are some of the most powerful and most overlooked tools for protecting your well-being. From the life-saving routine checks to where you can get screened, often at little to no cost, this is the health advice that we all need, but rarely hear. So stick around, your future self will thank you. If you're ready, let's dive in. When it comes to our health, many of us wait until something feels wrong before we take action and seek help. This reactive way of thinking is common and often shaped by the traditional Western healthcare system, which tends to focus more on treating illnesses rather than preventing them. Because of this sick care versus preventative care mindset, routine screenings and wellness checks can be misunderstood or ignored altogether. However, these simple health screenings are some of the most powerful tools we have to stay healthy. Screenings can catch conditions like heart disease, diabetes, or cancer early when they're easiest to treat, and sometimes can even help prevent illnesses altogether. No matter your age, keeping up with preventative care is a meaningful way to take care of yourself and the people who count on and care about you. Preventative screenings are medical tests that look for diseases before symptoms appear. These tests help doctors catch health concerns early when they're easier to treat or manage. Some conditions, like high blood pressure or high cholesterol, might not show any symptoms for years, but can lead to heart attack or stroke if left unchecked. Screenings also save lives. According to the Centers for Disease Control and Prevention, early detection through cancer screenings has significantly reduced the deaths from breast, cervical, and colorectal cancers. And routine wellness checks can help manage or even reverse chronic conditions like diabetes with early intervention. According to the U.S. Preventative Services Task Force, the following are commonly recommended screenings. For women, pap smears and HPV testing. Start at age 21 for cervical cancer screenings. Mammograms, every 1 to 2 years starting between ages 40 and 50, depending on individual risk. Bone density testing, typically recommended for women 65 plus or younger women at risk for osteoporosis. Cholesterol and blood pressure checks. Routine monitoring starting in early adulthood can be helpful. And colon cancer screenings, beginning at the age of 45. For men, prostate cancer screenings, starting at age 50 or earlier if at higher risk. Testicular exams, particularly important for younger men. Self-exams and awareness are often recommended by clinicians. Cholesterol and blood pressure checks have the same guidelines as for women. Diabetes screenings are recommended starting at the age of 35 for overweight adults, and colon cancer screenings also start at age 45. Both men and women, no matter your age, benefit from regular dental, vision, and hearing exams. It is also a good idea to talk with your doctor about staying up to date on recommended vaccines, especially if you have certain health conditions or plan to travel internationally. Age-appropriate immunizations are also worth considering as they may help protect against preventable illnesses and keep you feeling your best. Preventative care is more available and affordable than many people realize. Here are some common and trusted places where you can get screened. Primary care clinics. While you don't need to have a primary care doctor to access preventative care, most insurance plans, including Medicaid and Medicare, cover preventative screenings without a copay under the Affordable Care Act. Community health centers. Federally qualified health centers provide free or low-cost screenings regardless of insurance or immigration status. Find one at findahealthcenter.hrsa.gov. Planned Parenthood offers wellness exams, cancer screenings like PAP and HPV tests, and STI testing for all genders. Visit PlannedParenthood.org to find a location near you. Pharmacies and retail clinics. CVS, Minute Clinic, Walgreens, some grocery store chains, and other retail stores offer walk-in services like blood pressure, cholesterol, and diabetes screenings. Some also administer vaccines and refer out for additional care. Mobile clinics and health fairs. Many communities offer pop-up or mobile health events that provide free services. Check local health departments or libraries for upcoming events. And workplace wellness programs. Some employers offer annual biometric screenings, flu clinics, or wellness incentives that include preventative checkups. Preventative care is not just about avoiding illness. It's about feeling empowered and taking an active role in your own well-being. Whether you are long overdue for a routine screening or just beginning to focus more on your health, remember that early detection can truly make a difference. Please don't wait for symptoms to take the first step. Feeling fine doesn't always mean everything is fine, and waiting until something feels wrong can limit your options. Busy schedules, fear of results, or uncertainty about where to go are all valid concerns. But your health is worth making time for, and many screenings are quicker and easier than you might expect. Schedule your screenings. Talk with your provider or healthcare professional, and encourage the people you care about to do the same. You deserve to feel your best, and taking care of your health is a form of self-respect. It's never too early or too late to get started. You just listened to me read the article that I wrote titled Why Preventative Health Screenings Matter and Where to Get Them. Thank you so much for watching. Preventative healthcare isn't just about avoiding illness. It's about investing in yourself and the people who care about you. And that's what I'm passionate about. That's why I've made this channel. Whether it's a quick blood pressure check or a cancer screening, these small steps can make a huge difference. If you found this video helpful, give it a thumbs up and share with someone who might benefit. After all, our health is worth protecting, and it's never too early or too late to get started. Now, all of this, we gotta remember, it's not about reaching a destination. It's about enjoying the beautiful messiness of life and finding joy along the way. Take what you need from this, leave the rest, and until next time, stay well.